Hi there. My name is Cassandra Cannon. I go by Cassie. I'm a licensed clinical psychologist as well as an EMDR approved consultant. And I'm also an APA approved sponsor to provide continuing education. And one of the things I wanted to talk about today is the specific checklist type things that need to be completed before your client is ready to move on to reprocessing trauma targets. And there's two domains here. One is those specific items you need to go through and ensure have happened. And then there's the more clinical aspect of, is my client ready to engage in trauma reprocessing? Do they have the capacity? And if they don't, which specific domain do we need to strengthen before they're ready to move into that reprocessing? Because you want your client to be comfortable, confident, and set up for success so that they have a good experience in EMDR. So I will go through the more checklisty things first and then the capacity second. And so first things first, your client needs to understand how their past is currently impacting their present symptoms. If you have a client who is not interested in looking at the past, EMDR might not be the right fit for them. But if you explain to them these current symptoms today likely trace back to when this, and this happened, then they might start to understand why it's helpful to get to the root as to why they're having these symptoms. So how does the past connect to the present symptoms? And do they understand how trauma memories are actually stored differently in the brain than regular memories? And so I like to go through an explanation of how your brain normally processes information and then what it does with traumatic material. And I'll also go through the adaptive information processing model, meaning that your brain already knows how to do what it needs to do. It just, in this instance of trauma, it got stuck. It froze. And so what we need to do is create the environment for your brain to naturally heal itself and reprocess that memory. Sometimes I'll explain it to someone kind of like you are hitting the reset button or unplugging your computer or your electronics, waiting 30 seconds and then plugging it back in. Sometimes your brain just needs that little reset and then it knows how to process that information. I'm just here to make sure things don't get off track, and I'm here to keep you safe. I also want to walk through my client what an actual EMDR processing session looks like. So I'll explain how we set up targets, so phase 3, and then I'll explain how we'll be using eye movements or buzzers or tones, depending on their scenario. And once we've activated that neural network that's holding that memory, then we're going to be doing typically bilateral stimulation. And so at some point, I'm going to stop the bilaterals. I'm going to ask you to take a breath and tell me what you notice. And I just need to know one sentence of the, last however long we were doing the eye movements. I just need one sentence of what you're noticing now. I don't need to know the whole thing unless you really want to share that with me. But it is ideal if you just give me one sentence, maybe two, about where you're at now. And I'll also explain to them that I don't want them to tell me what they think I want to know. I want to know if nothing came up, or I want to know if they're thinking about Taco Tuesday. I want to know because that helps me know where they're at in that processing. So they can't give you a wrong answer because there is none. Also want them to really clearly understand what they can expect in session and after session. And particularly after session, they can have continued processing. Their brain's still working after our session, usually 24 to 48 hours, sometimes up to 72 hours. And generally, you're going to see Fatigue is a big one, and lower bandwidth is going to be another big one. And a little bit of extra anxiety might be there too. Sometimes people have dreams. And if they have more intense reactions, I like to talk to them about what that will look like and when they should reach out to me and when not. And I also have a handout that I give them. And I'll give the link in the first comment for that handout because they need to have something in their hands to look at. It helps them feel grounded and it helps them know, okay, yes, that's right. Because it's, they're not always going to remember everything you talk about in session. With that information, after you've explained the risks and the benefits of EMDR and why you're doing the trauma processing, then you want to document informed consent in some degree, whether it's, verbally received informed consent, or also an informed consent document is also helpful if you'd like to have that in your records. And I also have that available that will be in your comment. I also like to ensure that we've identified the right kind of bilaterals, whether it's eye movements. Remember, if someone has a seizure history, no eye movements. Also, is there a stop signal? They need to let you know if they need to pause or stop if the information is too intense, or sometimes on the very rare occasion, a client might access a memory of something they had kind of forgotten about and it's surprising to them. They need to feel comfortable telling you when to stop. And at minimum, I want my clients to have the container installed and a peaceful place installed. And people call it the calm place, the safe place, the secure place, the place where nothing bad is happening. Whatever you're calling that, somewhere for them to go in their mind to calm and ground. And if they're able to do that in session and it feels pretty seamless, then I feel comfortable once I've confirmed also that they have capacity, which we'll go into next. Then I feel comfortable moving on to reprocessing a memory. Now, one way to really evaluate if someone has the capacity, I created an EMDR preparation capacity assessment. And I have things split into domains because I like to have things operationalized. It's just kind of how I work. And so I made this for myself, but I also have it available for you. And the first domain is emotional regulation capacity. Can they tolerate emotions? Are they able to identify and name their emotions? Can they use their coping or grounding skills? That's really important. Do they have distress tolerance? So when difficult material comes up, are they able to just be with that discomfort? Or do they shut down? And then you lose them the rest of the session. So you want to make sure that they're able to recover within session, they're able to remain present with difficult material, and that they don't shut down. Dual attention capacity and dissociation are really similar, but I've split them up. Dual attention means, are they able to stay here while recalling the past? Or do they get totally sucked into the past? You want them to be able to keep one foot here and one foot there and be able to know, I'm here, but I'm just remembering the past. And so they're oriented to the room and the environment, and they can come fully back into the room with you when they're prompted. Dissociation, you must, at least at minimum, do a screener. And once you've identified that their dissociative symptoms aren't going to get in the way of processing, and that is another video that I am going to do. So I won't do that here. But once you have ensured that they are able to identify when they're dissociating and able to, I like to use the back of head scale where they tell you whether they're here or not, and again, another video, but are they able to tell you and come back? And are they able to, for the most part, stay present without dissociating? If you're finding that they're continually dissociating, then you need to take some steps back and spend some more time preparing them. And then between sessions, it's another domain I like to look at. One thing to note after your first session, when you've started to discuss their past, what was that like for them immediately that evening and the next day or two? Some people report a sense of relief at being able to share that information. Other people get a little activated, and that's just information for you to know, okay, this person might have more reactions in between sessions. And so you want to make sure that you've got a distress plan in place, coping skills, they have support systems available, and that they can use your container, your peaceful place, whatever other coping skills that you have decided that work best for them, can they use those outside of session? And then two other domains that's really important is, do they have that insight? I mentioned it at the beginning, but do they have that insight between I'm processing this memory or event because it's connected to my current symptoms in this way? And then clinical stability. Are they at risk for self-harm or harm to others? Have they recently been hospitalized or at high risk of being hospitalized? Then you need to spend some more time making sure that they're integrated back into their daily life. I would say at least a month to 6 weeks. And then they have, stabilizing factors are managed, housing, and they're medically stable. And the people in their life are safe. I hope having that information laid out for you was helpful. I have a checklist available for you to just have, so you can check things off that this is done, this is done, this is done. You can even put that checklist in your master treatment plan for the preparation phase if you would like. Thank you for spending your time with me.